Hello, my name is Kathleen Lisson. I'm a certified lymphedema therapist and board certified massage therapist. I have a practice in San Diego, California, and I help clients after plastic surgery, including Brazilian butt lift, liposuction, tummy tuck, facelifts, mommy makeovers, reduce their swelling and reduce their fibrosis with a type of massage called manual lymphatic drainage. So this is the first in a series of what I'd like to call the lymphatic massage therapist book club. So I will be looking at going chapter by chapter in different books that I think are really valuable for us as lymphatic massage therapists to learn more about what happens with our clients during surgery and during recovery. So this first book is High Definition Body Sculpting. I really like this book. We will go chapter to chapter, but I will give you a what do we call it? Like a sneak peek or like a cliffhanger of basically why I really like this book. I'm looking forward to reviewing one of the later chapters in the book, which focuses on lymphatic massage, the importance of lymphatic massage, and other things that you can do from a plastic surgeon's perspective. This is a book written by plastic surgeons for plastic surgeons on how to get their clients to recover after plastic surgery. So let's get right into it. Let's do chapter 1. So I like how this chapter starts. It's very almost like a romantic version of how the surgeon should focus on their craft as an artist, and focus on the human form as shown in different artworks throughout history, and focus on how they can use looking at the artwork of the human form to inform their plastic surgery practice. So I'll show you a quote that's on page 5 right here. It says, "A beautiful body can be considered to be one that attracts our attention and elicits a positive emotional response." So why did I like this quote? I liked it because so many times we will see plastic surgery spoken about when the surgeons put up on Instagram or some social media. Someone will put up an image of someone and say, like, did they have surgery? Was their surgery botched? And a lot of conversation around that. So it's good for me to see these surgeons have come up with a two-pronged definition of what the success is in their surgery. Creating this beautiful body, 1, attracts attention, and 2, elicits a positive emotional response. So we've seen a lot of surgery that attracts attention, but maybe it's not a positive response. And then we've seen some surgery that doesn't necessarily attract attention. And then clients are very frustrated because they're not getting the results that they thought they wanted. So I like that two-pronged definition. And then we'll go on to page 7, and I really like how they treated in length in several sentences what the ideal figure that they're trying to attempt to create is, and some things that can affect the success of the surgery. So on page 7, they say poor posture related to lack of exercise or conformity also affects the shape of the body. So poor posture, they actually have on page 9 this nice image of different types of posture and how the person holds themselves after plastic surgery can influence how they look in their body. So I really like that they pointed that out. And then they also talk about, in women, they talk about in men too, but in women is what I'll focus on. There are certain areas, certain curves of the body that are seen as more aesthetic. So in women, they said in the book, lumbar lordosis, so that's that curve in the low spine, convexities of the chest and the buttocks, so the positive curves, the positive fat in the chest and the buttocks, and interestingly, muscular definition in the calves. So those are the physical features that they say, quote, produce attractive curves in women. And they say curves are essential cues to human reproductive health, endocrine status, athleticism, strength, and longevity. So that's their idea for why they are forming these curves in the body, why these curves are looked at. And then they go on at some length, the entire rest of this page, I'll read, with poorly developed abdominal wall muscles, for example, the intra-abdominal organs are displaced and the abdomen protrudes. Since lipoplasty affects only subcutaneous abdominal fat, it is not a solution for abdominal protrusions secondary to muscle wall weakness or intra-abdominal fat. This requires a specific exercise program to improve core body strength and flatten the abdomen, often in combination with lipoplasty, to reduce stubborn subcutaneous fat. And then on page 12, they have this great image, which is if you have fat inside your body in the organs, the liposuction is not going to take care of that. You need to reduce the fat inside the organs. Liposuction can only reduce the fat outside. So that was really great. So what I really liked about that is this is not something that a lot of clients know specifically. Even up to yesterday, just this week, I was talking about how I really tell my clients as soon as they're cleared for exercise, they need to do some exercises. I have an exercise program that shows different exercises they can do as they get back into movement after surgery. And someone actually wrote to me on the Facebook, like in a joking way, but I know she was serious. We get surgery so we don't have to go to the gym. And I really like that in chapter 1, in the very first chapter, these plastic surgeons are very clear that you do indeed have to go to the gym. You have to focus on these muscles and strengthening them after surgery. That is how you are going to get positive results from your liposuction. So that is chapter 1, and definitely look forward to future videos where I'll be talking about future chapters. All right, have a good day.